Hello, it's Patricia Coughlin responding to a question by a subscriber about how to understand, how to first of all detect, and then understand the underlying conflicts responsible for sexual dysfunction. To me, it's somewhat alarming that so many therapists finish their training without having had much education in the way of understanding sexual functioning, sexual conflicts that can interfere with that functioning. And so you're going to have to do some additional work to get knowledgeable and also comfortable, right, in talking about sexual matters, sexual functioning, sexual feelings, sexual fantasies. This is a problem for many, many people. So it's something you want to become knowledgeable about. So let's take impotence as an example. Again, I all too often see therapists rushing in to intervene and treat a symptom like this without having any understanding of what's actually causing that symptom. Certainly in ISTDP, we are there to get to the bottom of it, which means we're wanting to discover the underlying cause of the symptom and address it and resolve it at the cause so the symptom resolves itself in a sense. So, what are some of the ways that you can discover what the conflict is responsible, in this case, for the symptom of impotence? So, you have to do some good dynamic inquiry here. One of your first questions is going to be, has this always been a problem? There's a big difference between what we call primary impotence, which is impotence from the very first attempt at intercourse. That's more rare. It certainly exists, and I have examples of that. But much more often, you're going to have what's called secondary impotence. And so this is the case where, people were able to function for some time, and then along the way, they begin to have problems with erections. Now, of course, depending on the age of the person, their health, you're going to want to make sure that they've been checked out physically. And there are often multiple causes of symptoms. So we're not looking for perhaps just one thing. But as we begin to explore the origin of this symptom, when, where, with whom, right, does this symptom arise, you're going to get some hints about the underlying conflict. So if you have a man who has always been able to function fine, and let's say in the last 6 months has had trouble with erections, as you begin to ask what's been happening during that time, you might find out that, oh, well, my wife had a baby. And that the problem actually started even once he learned that she was pregnant. And so in this case, you might well discover that there is a conflict about having sex with a mother. So once their lover and wife becomes a mother, the conflicts about sexual feelings toward family members could arise where it just hadn't been an issue prior. That can also happen suddenly when someone gets married, right? So they were fine before, right? So is it an issue around closeness, commitment, some sort of terror of that and shutting down and withdrawing? Or is your investigation going to reveal that it has more to do with forbidden sexual feelings and impulses toward family members? So again, how are you going to discover whether this is the case? One of the best ways to get a window into the unconscious origin of the patient's symptoms is to ask about their fantasies, and in particular, masturbatory fantasies, how those started. Unfortunately, these days, so many young people are hooked on pornography, which has profound effects on the brain, right? So their brain is getting wired, in a sense, by somebody else's fantasies. They really rely on these external sources of stimulation instead of having investigated what their own feelings, fantasies, desires are. And if, again, you have younger men who have been using pornography and really can't perform and get erections and penetrate an actual woman, you might have problems there around, again, just intimacy and closeness, being able to be real with a real person as opposed to some fantasy image on the screen. I'm thinking of another case, a man who was referred to me by his urologist because he had been having trouble with erections for the past year or so. I saw him individually, and we really couldn't come up with much. As far as what was happening a year ago, that was any different. And so I actually suggested that in the next session he bring his wife in. And when she came in the room, I was struck immediately by her size. She was probably 100 pounds overweight. She was enormous. And apparently this had been happening just over the past year or two, that she had really ballooned up in weight. And this man was somewhat, passive and so kind and nice. Like, he didn't even mention to me the size of his wife. So this was both literally and metaphorically like the elephant in the room. So he was sparing her, right? It had nothing to do with her. So it was something with him. And so you'll sometimes find that it has to do with something like that, going on in the relationship. But most often what I have found is that the source of the anxiety and inhibition around, as Melanie Klein would say, having a good go at one's partner, what does that require? It really requires that the man be able to integrate his sexual loving feelings with some healthy aggression. And so if there is a conflict about that, which I often find, that as the man becomes angry with his wife, angry with the woman he loves, he finds it increasingly difficult to actually have sex with her. And so in these cases, as you begin to investigate the experience of the anger, and very often these men don't stand up to their wives. They have conflicts about anger, tend to be passive and compliant and subservient. And so that is going to have to be worked on so that they're going to be able to harness that anger and use it to stand up, right, in more ways than one. So this whole issue around conflicts around anger and sexuality, also around, again, Oedipal issues, the forbidden having the woman that one wants, always ending up the loser. Or I had a case in which the man, and he was totally baffled by this, he was never able to function, actually from his very first experience, with an attractive peer who he actually had feelings for. And over time, what he found was he was only able to get erect and penetrate and have sex with a woman who he considered old and ugly, who he devalued in some way and didn't have positive feelings toward. And as we worked together, we were able to discover that his mother, who really was the old, ugly one, had a very unhealthy, sexualized, intrusive sort of relationship with him, which evoked at once some, sexual arousal about the way that she would touch him, but at the same time, rage that she was intruding on his body in this way and had no boundaries. So when he got sexually aroused, this rage also got mobilized. So if he cared about the woman, he would become impotent. He would be both protecting her from his rage and at the same time, in a sense, staying loyal to his mother. He could only have sex with people who, in a sense, represented his mother. And he was still staying her good, compliant little boy. So we had to work through all of those intense, both sexual and aggressive feelings toward the mother, so he could integrate those and then be able to actually have sex with a woman that he loved and desired. So as I hope you can see, there are going to be different sources of conflict. It can be around sex and aggression. It can be around forbidden sort of Oedipal issues. And you can also have other factors, health factors, relationship factors, and also use of pornography, all of which have to be investigated very specifically. So I hope this is helpful to you. Please give me feedback on what else you need to know about this so you can begin to really inquire with your patients and discover the underlying cause of their sexual difficulties. Okay, thanks, and I'll see you next time.